to the Invisibly Aware Series. We're going to be talking about circulatory conditions today. I'm Stephanie. I'm the co-president and co-founder of Invisible Illness Awareness Network, along with Sarah. And I'll do a brief image description for myself, like our guest video description. I'm a white woman with medium-length brown hair, wearing a green and white striped shirt. Let's get started. So a brief introduction of what is Invisible Illness Awareness Network. We're a 501c3 nonprofit organization, and we raise awareness for different invisible illnesses, chronic illnesses, and disabilities. We also help students start affiliate organizations at their respective institutions so they can be leaders and educate their peers, especially those interested in pre-health careers, on invisible illnesses to create an inclusive environment to benefit patients and their families affected by invisible illnesses, and just to know more before they go into their respective careers. So the Invisibly Aware series is something that you're joining us today for. We have 2 meetings every month virtually on Zoom, and we go over different conditions and topics relating to invisible illnesses. The first meeting of the month, we do a presentation on our topics, and the second meeting, we have guest speakers talk about their experience living with the conditions we cover, whether they be treating them as healthcare professionals, caring for someone who has them, or our patients themselves experiencing the conditions that we talk about. So yeah, welcome. Thank you for joining us. So you can follow us on Instagram. We're most active on Invisible Illness Network. And we also have an Instagram purely for the Invisibly Aware series as well. And our website is where you can find the most information. It's iianetwork.org. And you can scan the QR code for our link tree with all of these separate links and other links for our newsletter and things like that. And our calendar for our Invisibly Aware series and what meetings and topics we do. And we'll have announcements at the end of the meeting as well to go over what we're going over next month. But yeah. And I'll hand it over to Prabnor, who's going to be leading our meeting tonight.
Hi, everyone. My name is Prabnor. I'm the Director of Education. And thank you so much to our guest speakers for being here today. And before we begin, we just wanted to offer some disclaimers before we talk about the conditions we'll be discussing. So none of this is medical advice. If you're concerned about any of these issues, we advise you to talk to your doctor. Also, like we always say, no two people with the same condition have the same lived experience. And finally, we are not experts on these topics. We've done our fair share of research. And as you'll see, we're going to have our guest speakers talk about their personal experiences with these conditions today. And before we begin, if you have any questions, we ask that you can put them in the chat or you can message Sarah privately on Zoom. And if you want your question to be asked anonymously, you can do that and Sarah will ask it anonymously. And at the end of the presentation, we'll answer all of your questions to the best of our knowledge. Okay. So what we'll be focusing on today are 3 conditions: congenital heart disease, CHD, hemophilia, and median arcuate ligament syndrome, also known as MALS. And before we proceed, we just want to provide a content warning. So CHD and hemophilia can be fatal. So we just wanted to provide a content warning for the things we'll be discussing today. So a quick summary of what we talked about in our informational session last session, but some key takeaways. So congenital heart disease is a structural issue of the heart, and it is something people are born with, and it has to do with having holes or abnormal valves or chamber blood vessel problems. And the impact it can have on the body really has to do with blood flow and potential blockages of the vessels. And in terms of the prevalence, it affects about 1% of births worldwide. And there's a very wide variety of symptoms. And treatment goes along with that. Treatment varies based on severity. It can include surgery and medications for management. And finally, there are severe complications for CHD, and it can be fatal if severe. So the next condition we want to provide some takeaways for is hemophilia. So what is hemophilia? It's a genetic mutation which essentially presents physiologically in reduction of blood clotting. And this can be inherited or it can be acquired. And if it's acquired, it's considered an autoimmune condition. And there are 3 types of hemophilia. So there's A, B, and C, and each are involving a different clotting factor in the body. And A and B are involved on the genes on the X chromosome, and C is on chromosome 4. Prevalence definitely varies by the type of hemophilia. So C is the rarest, while A and B are more common with people with XX chromosomes. And symptoms are a little more defined here in hemophilia. So there's excessive bleeding, easy bruising, and bleeding into muscles and joints. And treatments include replacement of blood clotting factor, as well as preventative medications, and then treatments during management of bleeds. And then some severe complications can be joint damage, internal bleeding, and fatality as well. And then our last takeaway slide is for MALS, Median Arcuate Ligament Syndrome. So this is a vascular compression syndrome in which the median arcuate ligament compresses the celiac artery. And so because of this compression, there's reduced blood flow to the organs in the upper abdomen, and this often manifests in symptoms of severe abdominal pain, especially after eating. There's also symptoms of weight loss, nausea, vomiting, diarrhea, constipation, and malnutrition. The prevalence of MALS is rare in that it affects 1 in every 50,000 people. And as of now, the only treatment per se for MALS is surgery. But an important caveat is that it can come back over time, and surgery is only effective for 60 to 80% of patients. Symptoms can be managed and treated by medications and switching diets, being like sensitive to the diet changes that someone is going through. And without further ado, I want to introduce our guest speakers today. So thank you so much once again for being here. We really are grateful for your time and insights. And so our guest speakers are going to be sharing either their personal experiences with one of these conditions or being a caregiver for people with these conditions. So I'm going to quickly share your names and then ask if each of you can maybe give a quick little introduction, maybe provide a visual description. I realize I didn't do that, but for everyone here, my name is Prabnor. I'm a South Asian woman. I have long black hair and I'm wearing a brown shirt. And our 3 guest speakers are Angela, Kristina, and Keeley. So if anyone wants to jump in to introduce themselves first, that would be great.
Sure, I'll jump in. So hi, my name is Angela. I am a white woman with, short, dark brown hair, blue eyes, glasses, and a black shirt.
Hi, I'm Kristina Robinson. I am a white woman with short, dark brown hair, green eyes, and a black tank top.
Hi, I'm Keeley, and I am a woman with blonde hair, blue eyes, and wearing a cardigan with a white shirt.
Awesome. Thank you so much. And if you don't mind, we'll kind of just get right into the questions. This is very informal. Please feel free to unmute at any point. There's not really an order. If you feel like you don't want to share for a certain question, please feel free to skip that one. But we'll just start going ahead if that's okay. Awesome. So our first question is, what is your experience with circulatory conditions? Specifically, if you don't mind sharing, what is your diagnosis or what is the diagnosis of the people that you are a caretaker for?
I don't mind starting. So I am a caretaker for a 4-year-old boy, and he is diagnosed with severe hemophilia A. Sorry, do you want me to elaborate as well on my experience, I assume?
Yeah, either way, if you
Okay.
feel comfortable. Yeah.
Yeah, no, that's fine. So I will say that so far our experience has been pretty good. Pretty thankful that in today's world, medication has advanced quite a bit. even specifically in the last 7 years, the medication that he uses as a preventative treatment was FDA approved. I think it was 7 years ago. And it's been, for most people that have been on it, it has been a real life changer for lifestyles for people with particularly severe hemophilia. So my son has been lucky enough to have had I mean, he's only 4, so there will be things that he's not allowed to do as he gets older, such as like real hard hitting contact sports and whatnot. But so far he's been able to live, a relatively normal life, whatever that means. So we've been lucky. The beginning of his diagnosis was scary, I will say, because technically it's inherited. I found out I was a carrier, but I had previously had no knowledge or signs, symptoms, or anything. So his diagnosis was a little bit scary because we didn't know anything about hemophilia at all. So it was a whole new world that we needed to learn about, which we're still navigating and learning. There's more to learn every day, but it's going well. We're in a pretty good routine, and he's handling his injections well as a 4-year-old can.
Thank you so much.
I can go next. So I was diagnosed with MALS, median arcuate ligament syndrome. I also have a few other circulatory conditions: Nutcracker syndrome, May-Thurner syndrome, superior mesenteric artery syndrome, and pelvic congestion syndrome. So those actually all got diagnosed last year, all at once. So it was definitely quite overwhelming and trying to figure out, what do you treat first? And so I did end up treating the MALS first. I had surgery back in October. So I'm about, I think, 8 months post-op now. And, doing a lot better than I was. My quality of life was really terrible, right going up into surgery. Things had gone, really downhill, where I wasn't really able to eat anything. I couldn't sit up. I couldn't really function. So, I'm really grateful that, there was a treatment option, and I seem to be like responding really well to it.
Okay. So I was sorry. I have the congenital heart defect, and there's about 35 different kinds of congenital heart defects. And I have one that's called hypoplastic left heart syndrome, which essentially means that I have only half of a heart. So the left side of my heart was underdeveloped when I was born. And there's no reason why, there's no cause or anything like that. It doesn't run in my family or anything. It's just something I was born with. And I had 3 open heart surgeries, and now the right side does all of the work. So I had an open heart surgery when I was 7 days old, and then 5.5 months, and then 3.5 years. And luckily, my Fontan surgery, which is number 3, has been the last open heart surgery that I've had. I'm 26 years old. And yeah, so it's been a journey. It's been up and down roller coaster. I don't know what else to say.
Thank you so much, everyone, for sharing that. I know we touched on it a little bit in everyone's responses, but we were wondering what the process of getting diagnosed was. Angela, I know you mentioned that you had a lot of diagnoses come in at once. Kristina, you also mentioned that beginning diagnostic process was like very unfamiliar territory. And I know, Keeley, this is something that you've been living with since birth. So maybe if you could share a little bit about what like treatment ups and downs has looked like for you. But anyone can jump in. Yeah.
Well, I will say, leading up to the diagnosis, as I think Kristina said about technology improving so much, now if there is a baby with congenital heart defects, or in my case, my specific heart condition, you are able to detect it in the womb. And I do know you can perform the first surgery like in utero. And since I was born in 98, that was not a thing. They thought I just had a heart murmur. And my parents were literally packing up, getting ready to leave the hospital. And a nurse walked by the nursery and noticed my lip was blue. And that's the only reason why they caught my heart condition. And so they started doing testing and realized, oh, her heart wasn't fully developed. She's not getting enough blood and oxygen to her head and to her toes and to her fingers. And that's how they diagnosed my heart condition. So nowadays it is a little easier to see, but I always encourage when my friends have babies to always make sure and check the oxygen levels, because that's a big teller on if your baby's actually healthy, because they just said it was a heart murmur for me, but it wasn't.
Thank you so much.
Mm-hmm.
Oh, sorry, go ahead.
Go ahead.
Okay. So Axel, oddly was not diagnosed until he was 9.5, 10 months old, which for a baby with severe hemophilia is very uncommon. Most babies with severe hemophilia are diagnosed basically at birth or, within a few days after. But somehow we got really lucky and he didn't have any bleeding events. Because a lot of babies with severe hemophilia, they'll bleed excessively, even from like the little heel pricks or the baby, the common baby vaccines that they get before they even leave the hospital. He was circumcised and that was no problem at all. And I happen to know a few little boys now from meeting people in the hemophilia community, during circumcision, it was like a total disaster, med flighted, blood transfusions, immediate treatment. And somehow Axel didn't have any of that, which I'm thankful for, but I don't know how we got past that. So his diagnosis came late. At about 10 months old, he was really, really crawling and really getting mobile, and his knees were just purple. And then I started noticing bruises like in his chest, like because you pick a baby up like this. And so my thumbs were bruising his chest, and I was just picking him up like a normal baby. So I knew it was very clear that something was not right. So we brought him into the hospital on our doctor's advice. She said, she knew I was concerned, and she said, why don't you send me photos rather than coming in here? And she saw the photos and she immediately was like, you need to go to the pediatric ER right now. I'm like, okay. Of course, they didn't diagnose him in the ER. They're not like they can't, but they sent me to Mass General the very next day morning at 8 a.m. So I was like, something's clearly happening. Like I have to now go to Mass General tomorrow morning, 8 a.m. Okay. And so they did their own blood work at Mass General. And I think we found out like 2 days later that it was in fact hemophilia and like of the severest level. So we were pretty quickly discussing treatment options after that.
Thank you.
Yeah, and then for my journey, for me, it was very challenging to get diagnosed. If you take a look in my chart, I probably have seen 100+ providers since about 2007 when symptoms started, and I played college basketball and symptoms really escalated then, but they couldn't figure out what was wrong. They put me through, extensive testing back then. Everything looked great. My labs looked great. Everything was fine. So, I think at that point I kind of figured, the doctors said I'm fine. I must be fine. And then in 2017, my GI issues became really unmanageable, and I was trying to change my diet. I have pictures of me sitting on my living room floor with all sorts of, anti-inflammatory diet recipes around me, just trying to figure out like what can we do to try to improve this. And unfortunately, the doctors were like chalking this up to be, you're nervous, you have too much stress in your life. That's all this is. And, I knew, I was like, something is just not right. So in 2019, I had an episode on a flight where there was tachycardia, abdominal pain. I was sweating through my clothes. Everyone was thinking it was, a PE blood clot or something like that. But again, ruled it out. Everything was fine. And they were like, your blood work's great. You look great. But finally in 2021, my body basically was just like, no. I woke up in the middle of the night, abdominal pain, tachycardia, again, sweating through my clothes. I lost my vision for a little bit, and I had to, ambulance ride into the emergency room, and they didn't know what was going on, right? So this kind of was an escalation point for me. And 2 years from that escalation point is how long it took me to get diagnosed last year with all these conditions. I had countless ambulance rides, ER visits, anaphylaxis emergencies. I was told I was anxious. I was told that, I was perfectly healthy. And, finally, I had to travel out of state last year to get my diagnosis for MALS, and I actually had my surgery out of state as well because they just didn't know, what to really do and where I was and with all the doctors that I've seen. So it was definitely a difficult journey, but I am grateful for those providers that helped me.
Thank you so much. I think that hearing everyone's responses really emphasize how varied that diagnostic delay and that timeline can be, especially. And I know a lot of times we talk about in previous IIN meetings, we've talked about how the diagnostic delay has a huge impact. But just hearing your responses, Kristina and Keeley, especially, I'm wondering the impact of so much information coming in at once. And having to kind of take in all this new information about something that you didn't even necessarily know about the day prior, or Keeley, like for your parents in that moment. And so I'm just, thank you.
They were handed college like essays, and they were handed, because they couldn't just go look it up on the internet. So they were handed like packets of just all the research that they had on it. And it wasn't much. So yeah, it was kind of frightening. And they gave my parents 3 options: heart transplant, surgeries, or to just let me, they said, go peacefully. And luckily my parents chose the good option that got me here today. Yeah. Which was the surgeries, not the heart transplant. Yeah.
Thank you. Kind of moving on to our next question, and we recognize that this definitely changes day to day, but we're wondering what day-to-day life is like in terms of symptoms and managing treatment. Is there anything that necessarily makes symptoms worse? Something that helps improve it? If anyone would like to share.
I think right now for Axel and kids with hemophilia, it's really just being on a prophylactic treatment plan. I know not from experience, thankfully, but I know that back in the day, that was not the norm. It was very, very common to just treat a bleed when and if it happened. But thankfully over time they're realizing that even one bleed into a joint can cause permanent damage to that joint. And they've also figured out over time that often people end up with a target joint, so they'll keep getting the same bleeds into the same joints. So it's super important to be aware of your diagnosis and be aware of your body and be on a treatment plan to sort of prevent bleeds altogether. So on a day-to-day basis, life is basically regular for Axel because he is on a prophylactic treatment plan, and I give him an injection at home every 2 weeks to prevent bleeds. And the thing is, when I say know your body, is because there could be a diagnosis of, mild hemophilia, but you bleed like you have severe hemophilia because for whatever reason, even though your diagnosis isn't actually severe, you bleed a lot. And so a lot of times at the beginning, early diagnosed days, your doctor might not suggest a prophylactic treatment. They might say, oh, well, no, you have mild hemophilia, so you don't need to be on this all the time. There's nothing to prevent. You're not going to bleed that much. But if you know your body and you listen to your body and you advocate for yourself, then for us, for people with hemophilia, that is important. And I would also say, if you have siblings that are girls, they need to be tested because my daughter has hemophilia as well, that we would have never known about without Axel's diagnosis. And she has no signs, symptoms. She's not on a preventative medication. And I don't think she needs to be. But who knows what's going to happen when she hits puberty, has babies, all those type of things. It's very important. And she also had to have an endoscopy, I don't know, a month ago. And I wasn't even thinking that an endoscopy was something that would be considered like invasive. I mean, of course it is, but like that's not where my head was at. And, I walked into the office and the nurse was like, so what are we going to do about her and her hemophilia? And I was like, oh, I can't believe I forgot about it. And it was fine. They got the medication she needed and all was well. But like, I called the hemophilia treatment center and I said, I can't believe I forgot. I can't believe I'm making this phone call right now from the doctor's appointment. What do we do? And they were like, oh yeah, you should have told us before, but no problem. We got you covered. So just advocate for yourself because most girls don't have a diagnosis at 6 years old.
Thank you.
So I would say for me, so day to day, I'll talk before surgery first. So I got to a place where, I think I said earlier, I couldn't function. It kept going more and more downhill. I was navigating, that severe epigastric upper abdominal pain where I couldn't eat or sit up. So from 2019 until surgery in October of 2023, I was laying down on my left-hand side just to be able to try to eat a little bit of food. And I couldn't breathe. I was experiencing a lot of shortness of breath. I couldn't take any sort of deep breaths without pain. My bowel motility was extremely slow. I required a ton of medication on a daily basis for that. I got to a place where I was malnourished because I couldn't get, my intake in. Dizzy all the time. My heart rate was fluctuating all the time. Severe nausea. I was vomiting. I had weight loss and weight gain. My body just did not know what to do. And a myriad of other symptoms where it got to a point where everything I did made symptoms worse, like not just eating or exercising, like just sitting, existing. It was really, really a challenge. Now, Post-mal surgery, there's significant improvement. I'm eating 3 full meals a day. I have no more upper abdominal pain. I'm working out about 5 days a week at this point. I'm able to walk distance. I'm maintaining my nutrition. My blood work has been good. Fully off all my bowel motility meds, which has been amazing. And some of my other compression symptoms improved too. So, my nutcracker syndrome flank pain has improved, my pelvic pain has improved. So we're hoping that continues. Anything can happen, but, I'm just trying to, celebrate those small wins or big wins, as we go. And I also have hypermobile Ehlers-Danlos syndrome and mast cell activation syndrome. So I still am dealing with symptoms of those 2 things, and still trying to fine tune those. But on the mouse front, I'm doing really well.
Thank you so much.
So for me, I would say to day, like you said, it varies. Not every day is going to be the same. And since this has been with me like my whole life, I would say even like certain years were better than others. And I've had like a lot of, like in 5th grade, it was really hard for me because my heart couldn't keep up with the growing I was doing. And so I was having heart pains and shortness of breath like a lot in 5th grade. And that's when I finally had to like stop doing PE, and I had to do like so I got a heart strengthener medication in 5th grade, and I'm still on that today. And so different things like that. But I guess the average day to day, well, like I said, it changes because before I got sick with COVID, I was rock climbing 3 times a week. I had a full-time job. I was just I was in the best condition that I had been in my entire life in 2019. And then in 2020, I got COVID before the world started to shut down. And so we didn't know really it was COVID until it was like kind of too late. And I was on oxygen for like 6 months afterwards, and relearned how to walk and lost all my muscle weight and just lost everything that I had. And so ever since then, it's been a really slow progress to get back. So now I can't exercise anymore, or like I'm not working full time, or I'm barely working like 20 hours, and that's just so much for me. And so it really depends on what stage of life I'm in right now. Well, so when I had COVID, it then kicked in like a thyroid disease. So I got Hashimoto's due to my immune system overworking. And then now I'm in the stages of what they call Fontan liver, which is a side effect of my last surgery, which is called the Fontan surgery. And so with that, I didn't know I was in. So since 2020 to 2022, I think, my body wasn't absorbing any protein. And so I wasn't able to gain the weight back or the muscle or anything back from what I had lost in 2020. And so I was at one point, I think it was 2021, or 22, it doesn't matter. I was basically like wheelchair ridden because I could hardly walk, and like I lost all the muscle. I so thin and like unhealthily thin. And that's when we discovered the Fontan liver. So should I say what the Fontan liver is? Okay, I wrote it down so I wouldn't forget, because I'm not very like medically terminology correct sometimes. Okay, so basically what it is I said it was the last surgery is the Fontan, and the Fontan surgery changed my circulatory system by diverting the blood vessels from the vena cava to my pulmonary artery. So it eventually starts to put, over time, this causes what they're starting to learn as Fontan liver, which is when the liver is under pressure due to the way the blood vessels are redirected. And so because this is putting so much pressure on my liver over time, I started to feel it. Like my liver started to hurt, and then that put pressure on my bowels and my stomach, and then I couldn't eat, and so then I was losing more weight, and so it was just like this huge snowball effect that happened. And they finally figured it out. It was kind of like Angela. They were like, it's anxiety. It's I don't know how many pregnancy tests they made me take, because they were like, oh, your stomach hurts, you're just pregnant. No, it was being like smushed. It was under so much pressure because my Fontan liver pressures, or my Fontan pressures, were off. So that was the whole thing. And then I got on a medicine called tadalafil, basically heart Viagra. And so that had helped my pressures, which is why I'm like doing so much better now. But even though I'm doing so much better now, I don't think I'm ever gonna get back to where I was in 2019. That's just kind of like where my heart's at. Because I only have half. It works twice as hard as anybody else. And so it makes the day-to-day harder, which makes the life harder. So like I went grocery shopping today, just grocery shopping. Oh my gosh, I was like shaking. I was so tired afterwards. I came up and took my pulse ox, and I was like 90/127 or something, just from grocery shopping and unloading the car. And so just different things like that are just so much harder. One more thing I'll say for the day-to-day is like sickness. Like I get sick really easily. So like when I do get sick hard and fast. So like COVID, I went from like rock climbing to a week later eating a 2-hour nap, or eating a half a sandwich and taking a 2-hour nap afterwards, and being on oxygen for 6 months. It was insane. And then senior year of high school, I got strep throat, went to the doctor, they gave me an antibiotic. Next day, couldn't swallow the antibiotic, so they gave me a new one. Next day I was in the hospital ICU with strep. Like my throat was almost swollen shut. Like it's just certain things. And even the common cold, you get sick, the normal average heart person gets sick with a common cold for like 3 days. I'm out for like 2 weeks. That's just how it is. It's just the system, everything, affects everything. And so it just makes it a lot harder for me. So that's my day-to-day. Sorry it took so long.
Well, first of all, I want to say thank you to everyone for sharing your stories. I know it's a very vulnerable thing to share, and I really appreciate you sharing that. And I also want to say that everyone's strength throughout this process and ability to persist and advocate for yourselves is incredibly inspirational. So just thank you so much. My next question is, we've definitely touched on it a little bit in terms of everyone's experiences, but if you had to say what your most impactful experience with your condition has been, good or bad, whether it was finally getting a treatment that worked for you, a medication that worked, or a moment in your diagnosis treatment that was particularly bad, if you would like to share.
I can share. The beginning of Axel's diagnosis was particularly bad. I feel like it's easy for me to talk about how his day-to-day today is relatively normal and he's doing well, and I'm thankful for that. But the beginning was awful. I knew nothing, as I already mentioned, and the doctors said, you basically have two options. You have what they call, as you mentioned earlier, factor replacement, or the newer medication that I mentioned he's on, which is not factor replacement. It is basically it mimics factor, if you will, but it's not actually replacing the factor in his body. So should he have an emergency or hurt himself, he will still need factor as an emergency, but whatever, that aside. So anyway, in the beginning, I knew nothing. I was nervous. I was scared. I didn't really know how or why I was supposed to make that call. But I decided, okay, let's do factor. This seems like the age-old medication that everybody's doing. At the time, this newer medication had only been FDA approved for 2 or 3 years. So I was like, I don't think I'm ready for that. And so we did factor, and we very quickly, I have to finish this call. Good job. Sorry. We very quickly got him scheduled for surgery for a port, because factor is via IV, and at the time he was only 10 months old. So, veins 3 to 5 times a week, depending, was a lot. Daisy. Yeah, I will. Go ahead. Okay. Sorry. My daughter's like, I can't reach my light switch.
That's all good. All good.
So it just all happened so fast, decision, surgery scheduled, no time to think, bring him in, all this. So okay, great. And in my mind, I'm like, this is great. We're just going to get this figured out super quick. And unfortunately, that's not how it went down. His port surgery failed, because the catheter that should have gone into his vein, went through his vein. So that's not a good situation for anybody, but particularly a child with a bleeding disorder. And it was a disaster. He was bleeding, his lungs were filling with blood. They literally had a chest tube collecting the blood in a sterile bucket in case they needed to give it back to him if they couldn't get blood down from the bank. I'm like, these are details I don't need to know. Well, don't tell me these things, please. But they have to, so whatever. And then he spent the next 5 days in the ICU, and it was horrific. And a port surgery, nobody wants a surgery of any kind if you can avoid it, but a port surgery is relatively common, not that hard. It's 30, 40 minutes. And most people, I believe, if I remember correctly, can get a port surgery and go home the same day. Axel was not going to go home the same day because of his hemophilia. He needed monitoring. He got his adenoids out and didn't even go home the same day, because just hemophilia complicates stuff like that. But, so to go from all these fast decisions, and then this big ICU stay, I'm like, of course, I'm a mother. This kid is not even a year old. And I'm like, I made the wrong choice. I shouldn't have done factor. This is my fault. I shouldn't have done this. And so those moments will probably live in my head for the rest of my life. I know I didn't make the wrong choice. I've come to terms with the mom guilt, and it is what it is. Going back on it at the time, I probably wouldn't have made a different choice, but it was not a fun few weeks. But I will say it did lead us to his current treatment plan that I wasn't in those moments ready to explore. And today I am so thankful for it. It's a completely different life than he would have been living had he gotten the port surgery and been on factor medication. So
Thank you. And I think it's really impactful to think about the uncertainty and the fear of uncertainty, especially in that moment. And I'm sure that's very relatable for a lot of people, a lot of caretakers and people experiencing conditions themselves, how incredibly terrifying that is. So I appreciate you bringing that up.
I think for me, I've had, you know, both good and bad. I think on the bad side of things, I've seen a side of the medical field I didn't know existed. You know, it's a more scary side, I would say, where, you know, I received a lot of medical gaslighting. I wasn't believed for a long time. You know, my best interests weren't always in mind, and there were so many unknowns. So I think those were, you know, to this day, if I have an anaphylaxis situation and need to go to the emergency room, I'm like terrified. I'll try to do anything I can at home to not have to go to the emergency room because I don't know if they're going to help me. So I've had so many times where they haven't. So, you know, I think that side of things is still, I'm still working through that. I don't know, you know, if I'll get past that. But you know, but on the flip side of things, I would say, you know, I've met and made some of the most amazing people in the chronic illness community. I've made some amazing friends. You know, in my surgery support group, you know, I have two people who are, you know, have become the best of friends for me, and they know exactly, you know, I only have to say like 2 words and they know exactly, you know, what I'm navigating or what I'm going through. And you know, for me, I started advocating pretty early in my journey when I realized how many unknowns there were. And, you know, it's allowed me to help other people through sharing my experience. And, you know, I've had quite a few messages from people on social media thanking me for sharing things. And they were able to, you know, ask their doctors more questions or get some testing that maybe I had mentioned in a post or something. So for me, I'm grateful for that opportunity to just be able to give back and potentially help someone get to their diagnosis quicker than I did.
I have a similar response. I didn't know a lot of people with my heart condition growing up. But now that I have Instagram, I have found a really nice community of not only heart people or like heart patients or my heart condition, but like just an overall like this, you know, just an overall invisible illness community. And that's been really nice. My first glimpse of that would be, I remember um, it was in 2019. There was this family who met me and their little boy had the same heart condition I have. And they wanted him to meet me in person. And I'll just never forget the like look on his face when he met me. It was like I was some celebrity or something. It was so cool to see. He asked me so many questions like, does your heart ever feel like this? Or does your heart ever feel like this? Or can you do this? Or can you do that? And, you know, and I'm just like, yeah, I get it. You know, I can't do this. Or I do feel tired all the time. Or, you know, and just for him to have that validation, like I'll never forget that moment. And that's kind of one of the reasons why I wanted to start my heart page, was just because I didn't have that growing up. It's becoming more and more as the medicine progresses, as the years are going, more people are living longer who have what I have. And that's really new. Unfortunately, I was told I wasn't going to live past like 15 or 18 or anything like that. So I remember graduating high school and thinking like that was the biggest accomplishment I'm ever going to do, was living past my 18th birthday. That was so cool. That was just so amazing. And here I am 26 and I'm married and I moved out of state and I'm living on my own. Like it's just, I, found my own doctors and it's wild. I never thought any of this would happen. But anyways, moments like those are amazing. And then I would say growing up, I had heart camp. So I don't know, Krista, if that's something your kid could ever go to, camp for his blood disorder.
He actually does have hemophilia camp,
Yeah.
and it's awesome.
Yeah.
It's
And
huge.
as a kid,
I mean,
you
he's
don't,
young right now, so he's like the
yeah,
little boy that met you.
right.
Like he sees the older boys like
Mm,
sticking themselves with needles, and he's like, "Oh, cool, me too,"
yeah.
which sounds really weird. Like, "Oh,
No,
let's go home and play with needles." But like in
yeah.
our life, in our home, that's normal. Like my
Mhm,
kids play with syringes in the tub. But like
mhm.
for us, that's
Yeah.
normal.
Yeah, I get it. And like during the heart camps, we didn't really talk about our heart problem. We just like, oh, it's time for your medicine. Okay, let's all just go. They called it the med shed. Let's all go to the med shed and take our nightly
That's
pills
cute.
or morning pills or whatever. I mean, in the staff were all like nurses and doctors, and kids went to camp with their surgeons, and like, and it was just really cool to have that. That was my first sense of community, even though we didn't talk about our heart problem. We all knew, we were all similar in some way. My brother and sister got to go to this like camp in the mountains, and they like hiked every day and did all those outdoorsy stuff, and I couldn't do that. First of all, I can't go above 6,000 elevation feet. So like, and so to have a heart camp was so cool. I'll never forget heart camp.
I love that you think that's cool, because
It's
I
so
never
cool.
know as like a mother, like, is this cool, or
Yeah,
is Axel going to be like, why are you sending me to this like bleeding disorder camp?
I think it's different.
So
It's different than like
hopefully
sending your
he feels
kid.
that way too.
Yeah, it's different than sending your kid to like band camp or something, because like those kids, they get it. There's a level of understanding that they don't even need to talk about. Like when
Mhm.
something happens, maybe he starts to bleed, or I don't know the exact thing, but the other kids aren't going to make a big deal about it or
Right,
call him like, oh, that's weird, or
right.
it's just like having a scar on my chest. I was like, oh, I'm going to wear a bikini because they can tolerate my scars,
Yeah,
like instead of kids staring at them being like, what's that? That was always so awkward,
absolutely.
yeah. So I recommend insert disease camp. It's really nice to have. Um, I still am in contact with a lot of my heart friends from heart camp,
Oh,
and I
I love
haven't
that.
been in almost 10 years. I started camp from 8 years old until I was 16 is when the age group that I could go to. I went every year. I had to
I
sleep for
love
like
that.
2 weeks afterwards. I had to sleep, but it was worth it. Because they have accommodations there. Anyways, I could talk about it forever. But yeah, those are the positive things about having my heart condition. Of course, there's bad things that I always remember too, but like your mom describing you as a ticking time bomb, that was a hard one time. Just certain things like that just kind of stick with you. But there can be good stuff too. Yeah,
It's good to focus on the good stuff.
you have to.
The bad stuff's bad. The bad stuff's not fun, but there's good
Yeah.
stuff too.
I mean, it's sad when you go to camp next year and your friend isn't there. Yeah, that's hard. So, anyways, stuff like that.
Thank you so much for sharing all about different communities. It's so like heartwarming to hear that, and the positive impact it's had. Um, that really made me happy to hear. Thank you.
Mhm.
I guess I want to be mindful of our time. We're coming up on our last 5 minutes. So I know we had a couple more questions, but if we are going to end with a question. Our question would be, if you could give advice to someone who is newly diagnosed or has found out that their child or a family member has been recently diagnosed with one of these conditions, what advice would you give them?
That's a hard one.
Yeah, for
I
me,
mean, not really, but a little bit hard.
for me, it's already been said through, I think, all of us. Advocate for yourself. Even when, I mean, I was a child, but my parents still advocated myself. My, dad stopped a nurse from giving me the wrong medication one time. That would have completely been fatal. So just being there, being on top of it. We've all kind of said that, your body, you'll learn about your body, your limitations, what you can do, your strengths. I think that's a huge one.
I would agree with that 100%. Advocate for yourself. Don't be afraid to question doctors, nurses, medical professional, whatever. Like, you know your body, you know your child, whatever the case may be. And oftentimes, when you are living with the chronic illness, you know more about it than the doctor. Well, maybe not your specialist, okay, but like in the ER, you find yourself in an emergency room situation, like you probably are going to know more about it than whoever you are met with at an emergency room or an urgent care or what have you. So definitely don't be afraid to advocate for yourself and question people and correct people. Do what you need to do for your own health and safety sometimes. And what we all just talked about, find community of people that truly understand for real what you're going through. You're going to find some of the best friendships that you've ever had that you probably never wanted. No one's looking for a medical condition, but you're going to come out of it with really deep, meaningful friendships. So don't be afraid to share your story. You're going to find great people.
Yeah, I agree with, everything you both said. And, I think joining those online support groups on Facebook, there's always a lot of information in there about, people's experiences. I often find that they keep a running list of experts for doctors too. So you don't have to, you can kind of look there too to try to find someone that is an expert so you can get the proper testing done. I always recommend doing your own research too. So when you go into these appointments, like you said, you can ask questions, if something isn't said or if the doctor isn't referring to something that you might have read, don't be afraid to speak up. And I always recommend too bringing a support person to your appointments if you can. There's so much information overload when you're sitting there trying to process and, you're thinking about, oh, did I ask all my questions? What comes next? It's always nice to have another set of eyes and ears in the room too. So afterwards you can debrief so that you can, make the best decisions that you possibly can.
Yes. Lastly, I would say something that was mentioned, but I want to say again, is that everyone is different, no matter if they have the same diagnosis. It's just everybody's body reacts differently. And so you have to treat the person as an individual with that condition.
Thank you so much. Great advice. And I learned so much today. So thank you for your time. I'm sure everyone here on the call feels the same way. And also, once again, I know we talked about a lot of vulnerable things. So thank you for sharing your stories. And once again, everybody's Instagram handles are here on the screen. But just one big final thank you so much for your time. I know it's not necessarily easy to hop on a call for an hour and talk about such personal things. So I really appreciate it. And before we say our goodbyes, if anyone has any questions, we encourage you to unmute at this point, or if you want to message Sarah privately to have an anonymous question, this would be the right time.
And I'll answer any questions if somebody DMs me on Instagram. Like I'm an
Me
open.
too.
Yeah.
Yeah.
Thank you.
Yeah, for sure.
Um,
It's all
So-
about community.
oh, I think I just got a poll. Yeah, I think there's a poll. If and are we able to? Is everyone able to see the poll?
Yeah.
Oh, I think so.
Yes. So
Oh,
this
yeah, okay.
Yeah, this is just a
Oh.
poll for us to get a little insight on everyone who's attending the meeting and get a little bit of background about where everyone's coming from. But if we have no other questions at this point, we want to provide a few announcements just about our follow us actually first, and then our announcements. But here's all of our, oh, sorry, can we go back one slide? Yeah, thanks so much. So this is all of our social media information. So we have our Instagram up there for Invisible Illness Network, and then we have a separate Instagram for the Invisibly Aware series, which we're at today. And then our YouTube website, Linktree is all up there, and you can scan the QR code if that's easier, just to get access to all of that. And then fun little announcements for looking forward. A lot of our board is going to be at the Dysautonomia International Conference. So if you are going, we encourage you to go up and say hi if you see anyone. And then July, our focus is going to be on neurological conditions. So we'll be covering multiple sclerosis, functional neurological disorder, and epilepsy. And so just like every month, we have one informational meeting and then one meeting like today with our guest speakers. And so our first meeting will be July 2nd at 8 p.m. and we'll be presenting about the neurological conditions. And then July 23rd will be our guest speaker panel. But as for that, that's all we have. I want to say thank you once again, Keeley, Kristina, and Angela, for your time. We really appreciate it.
Thank you
Thank
so much for
you.
sharing.
Actually, I do have a question. So I noticed in the beginning of this that it's said it was like being recorded and whatnot. Is there, or will you share a link or a way to like watch it back or share with people?
For sure, for sure. So we are going to post it to our YouTube channel, and I'm sure we can also like send the link directly to you as well. But it'll definitely be up on YouTube.
Okay, perfect.
Yeah, might take us a couple days just to review everything and get everything up, but it will definitely be shared soon.
Okay, yeah, no rush. I was just curious.
For sure. And I just want to say thank you guys for taking the time out of your day to talk about these things. As a fellow chronically ill person, I get it. Like it's hard to talk about sometimes, and your experiences are all unique and different, and you're constantly learning new things, and we just really appreciate you taking the time to educate us and share your experiences. As a hopeful future health care provider, along with some other people here, I know it's really important to learn the patient and caregiver perspectives of things, not just the healthcare provider. It's like it's all learning about all these things all together and how people can best work together to get the best treatment. And just thank you so much for sharing your experiences, and you're helping a lot of people by doing that. So thank you.